Wonderful. So now I can start the presentation again. Thank you for your patience. Whom am I? I'm a medical anthropologist from Austria. You can't read that, sorry. But there is the title over there. Kind of challenging if you have more roles. Excuse me. Today I'm not having as main job teaching anymore in health education, but I'm the head of the research department of a small NPO, a non-profit organization that works in non-academic care professions education in Vienna, Austria. Some of you might be familiar with the Medical Anthropology Europe network from the ASA. I was a teaching officer for some years. I'm the ex-leader of the special interest group Teaching Medical Anthropology to Health Professionals, which worked between 2015 and December 2022. And we tried to push forward the agenda initially on a European level, that then we went on for a global level to bring people together who teach in health education, to support each other, to exchange materials, discuss problems, many things that come around in relation to teaching in this challenging environment. And I'm also one of the co-founders of the Medical Anthropology for Health Education in the Arab region, an initiative that was founded by Mustafa Abdallah, who is a German-Egyptian medical anthropologist. And I'm a very recent member of the Applied Health Club, which is a club of the Applied Anthropology Network of IASA. The slides will be made available later, so you can just click on the links. I'm also a member of Solar Plexus, which is an Austrian non-profit organization that tries to put forward the issue of diversity. And this is the link to Carolyn as well. I am member of the special interest group of the Society of Medical Anthropology called Health Professions Education. I can't provide you a link at the moment, but as soon that there is one, we're going to publish this on the homepage of MAZE and in social media. And I'll train health professionals globally since many, many years. And this is the link. So what do we need to think of all this? I don't get rid of all these bars, I'm sorry. How I ended up in this was because I needed a job, and this was the only job I got. And I know that this is the case for many of you when you once finish your PhD or you have already finished it. And it's a good choice, I can say. It's very interesting, it's very demanding, but it's a choice where you can apply anthropological knowledge and where you really can have an impact on some part of society, and this is health professionals being able to carry out a good job. First of all, we need to think of what is a health profession. This depends on your country. So those listed here you might know, but not all of them might be included in the definition in the country where you come from, or where you currently work, or where you want to go. So if you have one to add, or I forgot one, please add this, and we all can learn from your experience. Medicine and nursing, those are very familiar for you. Occupational therapy, physiotherapy, speech and language therapy, psychotherapy. Plus you have also medical assistants, surgery assistants, social care work, clinical social work. Why this is important? Because in most countries, these professions are regulated by law. And this law also determines if you are allowed to work in health education without having yourself a degree in this discipline, or without, for example, in the case of the United States, if I'm right, you have the medical teacher exam. Without this exam, you're not allowed to teach in medicine. So this is one of the things when you say, I'm interested in health education, teaching, you need to figure out how are the laws. Furthermore, there are some other interesting aspects. in medicine, or for medicine, you have the World Federation of Medical Education, the WFMA, which says in a recommendation from 2020, medical anthropology, social sciences have to be part of a medical curriculum if you want a new approval of your curriculum within this framework, or if you have to renew your curriculum. And if you spend as university all the money to build up a medical curriculum and a medical faculty, you want to be recognized internationally. And so this is an instrument of power for us. Whenever you want to teach in medicine, you can use this recommendation. And I can tell you that we have used this successfully in Egypt. And the leaders of the faculties in Egypt, they were very open because they know about these recommendations and they know about this need. For all other health professions, as far as I know, it's partly part of curriculum to have or social sciences, which is more broad and where you can think of sociology, psychology, and anthropology. Or there is medical anthropology in there as an already existing discipline. But if this not happens, you will need course leaders, faculty managers, people who decide on curriculum, people who reform or are part of reforming committees, who need where you need to put your efforts in to lobby for medical anthropology and to get a teaching appointment. It depends a lot from the course leaders, so individuals, but it also depends then on the meta level, because the leader has to present the curriculum to the committee, and at some point, committees take political decisions as well. So it's also always a political act to get a social sciences discipline in a curriculum or not. This is not about content. This is not about mere academic reward. This is about politics as well. So if you want to build up a career, I can recommend you that one of the most important points is networking with the staff members from health faculties, with practitioners in healthcare. How to do this? You have to create your own strategy depending on what you want. Yes, probably a job. Do I want a permanent position? Do I need some temporary extra money? Do I want to be self-employed and offer courses wherever I get them? This is a decision you have to take, but you also need to have a vision. And I think this is one of the messages I want to give you. Yes, it's about having money on your bank account every month to be able to pay your bills, but you have to create a vision for yourself to work through that, to not lose the energy, because it's sometimes draining, and to show the others how important your discipline is. And there, for the creation of a vision at start for yourself, probably in discussion with others, in dialoguing with colleagues who are already there, will help you to create this vision. And then this vision will support you through difficulty moments as well. And then you go out. If you have decided, and how can you go out? You can use LinkedIn, which at the moment in Europe, in Central Europe where I live, but also in other places, is a business network that's used a lot. And I've already used it successfully for new contacts, for different purposes. And I always say as well, this is a forum for people who are more introvert and who are more shy to get in contact with new people, to do some networking without being physically present, which is going to a conference or going to working groups, or contacting even a health provider for an internship is something that asks you for more, asks for your physical presence probably, or also asks you for being very progressive and standing up for yourself, while LinkedIn could be a nice start. Yeah, contacting a health provider, I think this is also a message I would like to give you, because even So you have done your research in a healthcare institution. You have done your research or you're doing your research on a very specific topic. And you probably do not get other issues, which I'm talking later, that are important if you want to teach in health education. So doing an internship is very helpful and will also give you more credibility in front of the students and the colleagues of, for example, your medical faculty. And the old ask a friend who knows somebody to shadow for a shift at a healthcare institution or for being part of an NGO where they do some work related to healthcare. These personal contacts can be important for you to get open a window, as we say in German, or a door where you can then pass through easier. Unfortunately, as in many other spaces, it's a lot about context. But I have to say I haven't had this context before. So there is a way to get there when you don't have context at the moment, and you need to build this up, definitely. Then there is the thing what to teach. This might be very clear because there is a fixed curricula, and I tell you, please teach an introduction to medical anthropology, as we did this in a master course called Public Mental Health in Austria. So we organized this. You also may come to the point where people say, yeah, try an elective, create something for us. That might not be an introduction to whole medical anthropology that is interesting for this, but for example, you will teach occupational therapists and you chose family relationships, and you should bring in the diversity of society, the topic of migration. Another subject that you might be asked to teach or that you can offer to teach, most of us anthropologists are very well trained in qualitative research methods. They are a good door opener. Many courses for health professionals have excellent statistic stuff, people who are very good in quantitative methods, but a lack of competence in qualitative. I recommend you to look at some international organizations. Forgot the name now, but there is a huge institute about qualitative health research with yearly conferences, because if you do carry out studies with qualitative methods in healthcare or in the big field of health, you should be aware of some methodological issues to be able to publish later, to get credibility, not only to ask the question, oh, you only interviewed 15. That's not representable at all. This is just one of the questions you might get. And you need to prepare yourself to answer these questions because, of course, there's a justification for having only 15 participants. What I can tell you for like, what are you going to teach is you need not to invent the wheel again. You are able, by using the internet, but also like talking to colleagues, copy from others. Basic introductions to our subjects. Basic, like, let's talk about social determinants of health. These courses exist already, and you can draw onto others' experience about this, and you need not to spend hundreds of hours to develop a whole syllabus for a course if you're asked to do so. There is a lot of information out there in the internet. There is even teaching material available, as far as I know, from the Society of Medical Anthropology as well, and from others that you might find on the internet. Take the easy pathway for start. Go through the door that opens first and then develop further. And if this door opens and asks you qualitative research methods, accept this offer and then go ahead. Ask them, oh, I would like to make an elective course on medical anthropology, and many schools and faculties are open for elective courses. Of course, there you need to be careful, what does your employment include, and you should not work without being paid for what you're doing. I think we are all worth being fairly paid. University politics in this context are often not transparent. They're not inclusive. They're not easy to navigate. So before you sit down and offer somebody a course, try to open a door, sit down and do your studies about what does this university offer, how is it structured, in which course do I want to get in. The more precise you are, the more your proposal is adapted to the local needs, the more chance you have that they give you a chance to teach. How to navigate all this? You have undergraduate, postgraduate, or continued education programs in, and I really want to focus and tell you outside academia. In our Central European world and the German-speaking countries, every hospital has to offer continued education programs to the employees. Sometimes they have an own program, sometimes they send their employees to other education institutions. But the fact is that it's inside and outside academia where health professions education happens. And depending on if it's inside or outside, you need to adapt your language, you need to adapt the way you teach, adapt it, the way you teach, the materials you use. There is a difference if you teach social care workers who have probably a lower level of education, instead of teaching medical doctors who are physicians since 15 years. But they all need health education and continued education. They are obliged by law, at least in the country where I live, in Austria, but I believe in many other countries as well, to do their continued education. It is a big decision which professions you would like to address. Or do you want to create a course for multi-professional classes? You find examples, there is a spelling mistake on that, I'm sorry, at the University of Rovira e Virgili in Tarragona, Spain, because they offer these multi-professional classes. They can also be called interprofessional classes, where people from different health professions are coming together, and in Tarragona as well, social scientists, and learn together medical anthropology content. You have to choose. I want to educate nurses. I want to educate occupational therapists, like I do, both groups since some years, but there are many other options. Networking in anthropology is good and important so that you get known others' experiences and recommendations, like our new interest group, soon to be online, found. There is also the behavioral and social science teaching in medicine group. I can recommend to participate. They have monthly tea time meetings online. For Central European time zone, it's, I think, 4 p.m. in the afternoon. So that's very early in parts of the US and very late in Japan or Australia. But that's the challenge with timing of online meetings on this globe. And interdisciplinary conferences may also be of your interest, where you have a chance to present, for example, a poster, the benefits of medical anthropology for OT, for nursing, where you can network as well. In those conferences, you may meet colleagues who are more open to interprofessional collaborations, people who have already done this, or people who are curious about what an anthropologist does. So it might be a good start. You also may find conferences from, and I've not heard about other disciplines, so I'm sorry. I just know about medical education conferences. And I have heard about nursing education conferences. But for example, in occupational therapy, I don't know any international conference only on the education of occupational therapists might exist. Please have a look. What you need, some experience I have that in medicine, but in all other disciplines as well, teaching is often done via cases. And you need to learn how to write and teach successfully cases. Because this is a way they know already how to deal with new knowledge and new skills. And it's sometimes easier to adapt to the school's or faculty way of teaching instead of introducing, like, let's do ethnographic projects. That might be interesting, that might be a lot of fun, but you might be confronted with a lot of resistance from the students and even the colleagues. It's not easy to write good cases, but you have good examples in the internet. And my experience tells me that the best cases you get from practice. So try to talk to a medical doctor who works in an emergency room, and you could write down these cases. Try to find a structure for these cases, and then you can use them for teaching, and you can adapt them depending on what you need. If you have their medical information there or any information that's outside the discipline of anthropology, try to get a feedback from a health professional to make it the most accurate possible. Because it's getting very tricky in this type of teaching when the students feel that this case lacks of something, and this is often medical information, or it might be information about the care of a person. Train yourself how the local healthcare system works, as detailed as possible. Why? If you're not in the position that you are also a health professional, you will always receive, or you might receive, sorry to generalize, this phase of, oh, you're not a nurse, and then you don't know. And we need to get through this, you know, we need to navigate this and tell them, yeah, but I have spent an internship in this hospital, and I know this and that, and you have to show that you know the healthcare system, their working conditions, how interprofessional collaboration works, or just the profile of what an OT does. Because in some countries, and I can only talk about Austria in this detail, interprofessional collaboration is not that big in practice, and therefore not in education. If you're living in Sweden, for example, this is much bigger and people know what you're talking about. And then a medical doctor knows exactly what an OT does and when she should ask an OT or when she refers to an OT. While in other countries, this referral system, this knowledge about the others' competences is not that big. And then this can be an asset of you as a person. This includes finances of healthcare system. This includes management, epidemiology of diseases, how is a hospital managed, how are public health measures or campaigns, a lot of knowledge that an ordinary health profession student does not get in the course they do. So you acquire knowledge and skills that you can then put into the teaching and get credibility through knowing more than the students, not in medicine, but in the thing around medicine, the healthcare system. Knowledge about how a curriculum looks like is important, and also how you develop a syllabus, depending on which course and which university and which laws. Laws are very important in healthcare education, in health professions education, because there are the basis, and some laws are very detailed, like the nursing law in Austria, what a nurse is allowed to do and what not, and who should teach what and how much hours and which book sometimes. So you need to find a way to get known the curriculum. In our European group, or in our EASA group, we have found that there is no good handbook for teaching medical anthropology to health professions. Why? Because classically medical anthropology texts are too long and written in a style where it's often hard for them to understand because they lack basic concepts of anthropology. A person who offers some good text, for example, is Paul Farmer, but also Kleinman, Fixing Cultural Competency, I think is one of the texts, which is more accessible to health professions. So far we collected texts, we're still collecting texts, and trying to make up, everybody has its own compendium depending on the course and the level of students texts you can use. And it's always a try and error to find out. One text works with nurses, but doesn't work with OTs. One text works in Egypt, but nobody understands it in Brazil. So it's important that the text you use is a mix of that they understand the basic concept you want to communicate, but that it's locally grounded. And why I say that, from our project in Egypt, you have to know that Egyptian medical doctors are trained in English, and basically they have English textbooks from the UK or from the US. And you might think, okay, anatomy or pathology, it's the same. It should be the same around the world. Yeah, but if this anatomy book uses cases from the UK, it's useless in the Egyptian context because there are other ethnicities. There's other people there in this country. And therefore, it's very important that you use local grounded materials, texts, films, videos, whatever you use. It needs to have a connection to the local reality. For those who think to start teaching in health education, I recommend reading Iveris Martinez and Dennis Widman's book from 2021 about anthropology and medical education. It's a publication that summarizes experience from different countries around the globe about teaching anthropology and medical education. At the end, there's a chapter with 16 recommendations that I think are a nice summary that you might like to read to know what might be needed. Depending on your local reality, it might be different, but a good start to reflect on what they wrote. Andrew Russell from Durham University in the UK has published The Social Basis of Medicine in 2009, already some time ago, but there also you will get an idea how he interwove social science and medicine and the cases he put there and other things. I'm not sure, but I think I have not seen another edited volume of that or a re-edition. And under the link here, you also find a reading that might be interesting for you. Yeah, on this slide, I'm not going into, but you can find there my experience on teaching, qualitative research methods, occupational therapy, where I do medical anthropology, diversity in medicine, in psychology, and doing more free things. In Brazil, it's a speech and language therapy. I'm also teaching about violence in hospitals against health professionals because I did research about that. And yeah, there is a huge experience that we can read. Looking into the future, what might be interesting for you is knowledge about diversity management, because this is a huge topic for human resources and for project management in healthcare institutions. And anthropological knowledge and the anthropological lens on the diversity in a company can be very helpful. But once more, you need to show them what you can bring into the institution. They think they have the HR perspective, and that's enough. Interprofessional collaboration education of health professionals is growing bigger and bigger. I think especially in this, where you have different professionals or students of these professions, the anthropological theories and skills are an asset, and you might like to look into who is planning new projects and trying to get into some of these. And finally, as well, teaching in these continuing education programs, they exist in academia, but also in professional educational institutions, hospitals, many other institutions, because they might need teachers. To be fair, have a look at the price and try to find out also, if you make them a proposal, how much they normally pay for people, how much you think you deserve for being paid, because underpayment is, of course, very common in this educational world, and especially when you start, you're not aware of the prices and what you may ask for, and then you get overwhelmed by a lot of work, and your salary per hour drops to, I don't know, €3 or so, because you're doing it the first time and you need a lot of hours to put in this. So please don't forget the price. Yeah, and I would like to thank you for your patience, and had put my contact information here, my professional email address and my LinkedIn. And by stopping the recording now, I would like to open the discussion. Just a second.